I hope the stream has started. Yeah, so today what we're gonna do is going back to solving question papers. That is basically semester question papers of various colleges across the state of West Bengal. Basically, the colleges under West Bengal University of Health Sciences. I'll be solving the medicine paper one questions which would be there, and we're studying accordingly. So I have decided that I'm gonna study for 4 hours, which is going to be divided into a four-step Pomodoro, which is a 50 minutes of studying, 10 minutes of break. Again, 50 minutes of studying, 10 minutes of break. After studying for 4 hours, I'll okay. Audio is clipping, right? After studying, okay, still it's clipping. Yeah, now it's supposed to go right. After studying for 4 hours, what I'll do is that I'll take a break of 30 minutes, and then again maybe I'll continue to again continue solving question papers, because this is very important. Otherwise, you really don't have a very good hold of the subjects. Anyways, considering that these books are like around 1,000 pages each, and I have three of these books. This book over here, this quest is of around 400 pages, and this book over here is around like 1,500 pages. I don't even know how many pages is this book. Oh, 1,300 pages, right? And again, we have this book of practicals, right? This is again around 700 pages. Again, then I have to read Harrison also to make all these answers. And now you can't read all of this at the same time, right? You have to keep a boundary of where you're going to stop. So for the rest of my friends, I am doing medicine. Some of my friends are going to solve medicine paper 2 for me. I'm solving paper 1 for them, medicine paper 1. Some are going to solve the question papers of obstetrics. Some are going to solve the question paper of gynecology. Some are going to solve the question papers of pediatrics. So that is how we have divided within our friends. So I hope this goes good. Anyways, I've wasted a lot of hours from today morning, so I wish that I do it in a proper way right now. So I'll be waiting 3 more minutes just to chill down, just to calm down, and then I'll be back to my studying. And today I have a multi-camera setup for you guys. This is a setup where obviously you have the question papers. This, not this one. This is the where I was writing the answers. Like, okay, why do I need edit access? Okay, I have messed up something. You guys don't need to look at that thing. Okay, you can see that this is a multi-camera setup. Like, I fixed up a camera over there, and yeah, this is the thing. But right now you just look at me, camera right. Yeah, let me just fix this stuff. I don't know why it always gets into this mode. It's not right, but it's okay. Now it's fine. And yeah, I have multi-camera setup right today. I have and of course there's another setup for break. Yeah, multi-cam setup. So yeah, here you can see me studying. When I'm studying over here, you can see all of these things. Yeah, so 2 more minutes and then we'll get back to study. Okay, we are continuing with the college of like Diamond Harbour Government Medical College. This question paper, I have solved a bit out of this question paper. I think the most of it has been solved. The complicated biovax material I find out with no time. It's very easy. Then lactulose used in, I know this reason. EC as a contradiction. I know this. This I still have to read through. Okay, I'll just look it through once just to be double sure of what I'm doing. Yeah, then we're good to go. And once it's 3 o'clock, 3 p.m. right now, we'll start studying. So yeah, you have to wait for 2 minutes. And if you're joining in the future, it's okay. Let me just share the link of this with my friends. Not friends actually. This is for me. So that I can keep track of everything. Right now the stream is going pretty fine, so I have no problem with it. I was making a thumbnail over there in case you didn't understand. Sometimes I'll just take a sneak peek at the what do I call it, at the stream. Okay, so don't be amazed if I'm not speaking with you while I'm studying, because while studying I'll not look at the chat. I'll look at the chat only after finishing the entirety of like the 50 minutes. Then only I'll look at the chat. Otherwise I'll not look at the chat. So yeah, I'll maintain these things. These things have to maintain. Otherwise, the thing is you get derailed very easily. Also, I have this thing. This pen I was like. This pen was given to me by MRs. So we went on the Saturday clinical posting. Basically, yesterday I forgot to mention this thing, but yesterday when we went to a Saturday clinical posting, the MRs gifted us this. Like, we were 7 or 8 of us students, and they gifted all of us a pen of this. Basically, this is from a company, Dam, and the drug which they were marketing was tamsulosin. Okay, so tamsulosin is used sometimes in BP. It's not mainly used, mainly used in ureteric stones and all. So it's an alpha 1 blocker if I'm not wrong, and it basically dilates the prostate and also it allows the stones to pass through easily, and they often relieve symptoms of BPH and also that's the medical management of BPH, tamsulosin, blah 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 blah. So yeah, it's 3 o'clock. We'll start studying right now. I need to take a sip. Stay hydrated, friends. That was bad. Let's start studying. What do we have over here? Yeah. This question we have done. This mentioned various indications. Should the causes of my hyperchromic and anemia and disease of I think Isha. This is this is in hemat. Hypochromic anemia workup I think. I think the entirety of anemia workup is going to. I have tried this pen actually. Oh wow, this is hard. I like this pen already. Okay, lactulose is used in hepatic encephalopathy. I know this reason, but I'll just double check it just to be sure. You need to put in reference, otherwise it doesn't work that way. Encephalopathy. Wow, the answer is written beautifully over here. We'll just still read hepatic encephalopathy now. It's an important topic, okay? We just write it under hepatic encephalopathy. Chemotherapy. Oh, you have hepatorenal syndrome over here. Oh, you have ascites also. Wow. Could read all of this right now. Wow, you have bacterial peritonitis also. Wow. I'll read till 6:16 right now. Take 1 minute for the page to read. But yeah, let's read us. Question 601. I think this was given much more easily in Pomodoro, if I'm not wrong. Not gonna update it right now, we're gonna update it later. Don't have time for this thing right now. Why am I searching update? I think this is given better in Marrow, it seems like. Hepatic encephalopathy, also known as portosystemic encephalopathy, is a reversible syndrome of impaired brain function occurring in a patient with inflammation either as part of cirrhosis or as part of permanent but transferred portable systemic shunt. Wait, let me first read it and then we'll see the way. Maximum cerebral edema causes this type seizures. Okay, there are three types of hepatic encephalopathy: type A, type B, type C. Type A is fulminant and acute hepatic failure with occur within 7 days. Maximum cerebral edema occurs with this type of seizures. Type B is with tips, major portosystemic shunt, but no electricity damage. Type C cirrhosis and portal hypertension. Type A, type B, type C, fulminant, acute. Fulminant or acute is this type. Then type B is associated with total hepatic portosystemic shunt. Okay, type C is toxin is ammonia. Ammonia produced in intestine from dietary proteins active in the decarbonation. Ammonia is also non ammonia decreased due to urea cycle. Ammonia levels are increased. The urea cycle decreases not detoxified urea. Bypasses the river, increases porosystemic shunting. As a result of what happens is there is no urea cycle in the okay, that is happens no urea cycle in the brain. There will increase ammonia in circulation, enters brain, damages astrocyte and asteroid. Glutamate plus ammonia. They make glutamine, which is toxic to the brain cells. Most pathological cells are the astrocyte, hepatic encephalopaths are called Alzheimer type 2 astrocytes. Glutamate, total levels of glutamate are decreased in the patients with cirrhosis, hepatic encephalopathy, most probably reflecting consumption in the form of glutamine in the presence of hyperammonia. Glutamate concentrations in the extracellular space and the CSF are increased. They are increasing extracellular. Okay. No, extracellular and CSF are increased. Okay, this is how you identify early. Increasing the extracellular glutamate results in NMDA receptor activation in the astrocyte, which is key factor of steady state stress response. Or endotoxin, ammonia, glutamine. Okay, because ammonia means glutamine. Glutamate acts on it causes small peptides degradation to mix with the gut, phenols, free fatty acids, GABA basically. Gamma amino butyric acid, yeah, GABA. Octobamine, manganese, aromatic amino acids, precipitating factors in hepatic encephalopathy. Okay, these are what we need is precipitating. And there was another question regarding precipitating factors in decay. Just write down. Okay, right. Because it's very important. Decay doesn't happen just like that. Yesterday also I had something to read about. I forgot what to read. Okay, precipitating factors: sepsis, upper GI hemorrhage, blood transfusion, excess dietary fibers, constipation, azotemia, hypokalemia. What are the possible mechanisms? Increased ammonia production. Okay, sepsis, upper GI hemorrhage, blood transfusion, how excess dietary protein. Okay, constipation, azotemia, hypokalemia can lead to increased ammonia production, leading to hepatic encephalopathy. Systemic alkalosis following RAS activation, increased diffusion of ammonia across the blood-brain barrier. Okay, because it's systemic alkalosis. Dehydration, reduced metabolism of toxic because of hepatic hypoxia. Okay, polycystic shunts like transglobulin diabetic polycystic shunt causes type B hepatic encephalopathy. I know. Type C was what? Type C was the chronic, right? Cirrhosis and portal hypertension. Yeah, cirrhosis and portal hypertension. C for C. Right. Okay. See, now things are getting into your brain. Although before they were not. Reducing hepatic metabolism of toxin. Okay. Yeah, reduce hepatic metabolism of toxin because of the diversion of the use of benzodiazepines, activation of GABA benzodiazepines, renal failure, the use of other psychoactive drugs, C as depressant. Clinical feature of hepatic encephalopathy. Yeah, the modified West Haven criteria. This is such important. Look how difficult it has been here. Modified West Haven criteria. I think I'll read the marrow part. I'll say in the majority from marrow. Let me first read it through, then I'll say it's okay to read from marrow or not. Because this is covert and overt. No, and this is too difficult to memorize. Covert and overt. Okay, covert has two stages: minimal HE, grade 1 HE. Overt has grade 2, grade 3, grade 2, grade 3, grade 6. Okay. It should be grade 4, it's not grade 6. Grade 1, 2, 3, 4. Minimal 1, 2, 3, 4. Minimal is clinical findings and nil, basically psychometric alterations. And grade 1 is mild asterixis or tremor. Let's keep this thing. Tell patient, tell them to hold their hand like this and goes like clapping tremor. Mild asterixis, personality issues, behavioral changes, disorientation for time, lethargy, and apathy. Obvious asterixis, it's like very obvious. Slurs, develop grade 3 somnolence to semi-stupor. Similarly, basically, muscle rigidity, clonus, feel like frank clonus, hyperreflexia. Okay, look. What exactly is clonus? Hyperreflexia. Okay, type 4 is coma, disabled posture. Minimal HE has problem in psychometric test, which is the number connection test. Yeah. Asterix is demonstration of keep a forearm on level, press some dorsiflex, widely separate fingers not able to maintain position is called as asterix. Causes of asterix are hepatic encephalopathy, renal failure, respiratory failure, hypoglycemia, hypoxia, any kind of hypoxia, hypercapnia will cause asterix, renal failure, hypoglycemia, electrolyte abnormalities, Wilson's disease, urea cell, basically anything. Drugs, antiepileptics cause, wow, most commonly phenytoin and valproate cause. EG change in patients with cirrhosis would be seen grade 1 and 2 are slowing of EG, and grade 4 with triphasic waves which are seen on hepatic encephalopathy, very classical triphasic waves. EG and MRI show generalized swelling, decreased amplitude of waves, triphasic burst, and slow activity in theta and delta waves, which is grade 4, basically where you have gone into stupor and coma. Treatment: bowel wash with lactulose, non-absorbable discharge. Disaccharide, sorry, the lactulose is non-absorbable disaccharide lactulose action. Lactulose results in acidification, reduction of pH results in the formation of ammonia. What? Okay, ammonium ions results in acidification, reduction of pH, hence ammonia converts into the ammonium ion because the H plus goes and binds to it. Now it can't go into the blood. Fermented by colonic bacteria produce hydrogen volatile fatty acids. VFA used by the bacteria, less ammonia production. So it's okay. Laxative effect. And what's written over here? Let's read it once. Lactulose therapy. Lactulose is a non-absorbable disaccharide which acts as a osmotic in the colon. Lactulose and lactitol are catabolized by bacteria to lactic acid and acetic acid. It lowers the colonic pH, favors the absorption of non-absorbable NH4 plus would be. It's not NH plus, it's wrong. There's nothing called as NH plus, it's NH4 plus. It's ammonium ion, not NH plus. In the colon, thus reducing the plasma ammonium concentrations. Plasma ammonia other mechanisms include increase on incorporation of ammonia from the bacteria for the synthesis of nitrogen compounds, modification of colony flora, thus resulting in displays of urease producing bacteria with non-urease producing bacteria, and cathartic effects that improve the GI transit, allowing less time for the ammonia absorption, increased fecal nitrogen excretion due to the increase in stool volume, reduced formation of stool, short toxic short chain fatty acid. I think this one is better. I'll write the answer from here, but I'll read the entire of hepatic encephalus from marrow. This I think is the best. This is what Diamond Harbour Government Medical College and Hospital 8 Sam. Okay, we'll write the answer, but let's just read it once. Uh, Bowel wash is non-absorbable disaccharide, results in acidification, reduction of pH, results in okay. Rifaximin didn't give other drugs though. Yeah, but they give a lot of things. I think I'll read this part from. Oh my god, to read separate things from separate areas right now. Rifaximin isn't even mentioned. Okay, rifaximin is mentioned over there. Okay, I think I'll read it, the management from here, but the rest I'll read from here. Yeah, because I don't think I like this thing very much. Okay, no, I think you should read from here. Marrow is good, but yeah, won't get you down the answer. Given the patients intolerant to lactose. This is you see this like slowly I'm actually studying one after the another. Like the topics have been covered one after the another. So I think I'm not sad with all of these things. I'm happy with how it's turning out to be. Vaccine 400 milligram twice a day reduces ammonia production given to the patient intolerant to lactose in combination. Lola, which is L-ornithine L-aspartate. Branched amino acids, aromatic amino acids which are implicated while branched amino acids and aromatic amino acids are implicated while branched amino acids are protective in encephalopathy. Wow. Yeah. Carbos. Sodium bicarbonate. But again, encephalopathy. Narrow is from what to what? From 460 to 467 under scroll 70. Now let's just read from over here. Okay, we have read it from this source. Let's read it from this book. Hepatic encephalopathy, what system is a neuropsychiatric condition. Secondary to chronic liver disease. I don't care whether it's acute, reversible. It's potentially reversible, progressive. Cirrhosis, portal system shunt. Acute pulmonary mechanism is unknown, but 6 mechanism gut-derived neurotoxins metabolized by liver now known. Pain, water, homeostasis, oxidative nitrosative status, astrocyte dysregulation, neurotransmitter dysfunction, infection, inflammation. Due to disturbance of brain function resulting in yeah, I know. It's common sense. Why are you blabbering about the same thing? I think skip. Don't read this if there's no time. But again, sort of the toxic substance removed by the liver, the three factors response. What is the toxic which is not removed? These are the three factors response. reach the brain. Factors responsible are shunting, decrease liver mass, increase permeable blood-brain barrier. Okay, I understand. All of these things make sense. Okay, hepatic insulin associated with acute liver failure type A, hepatic insulin associated with post-systemic bypass, and no, basically shunt, and this is a C for a C. Minimal, episodic, persistent, episodic, precipitate, spontaneous. This is better actually. No, don't go into all these things. The precipitate factor, increased protein load, dietary, fluid disturbances, hyperkalemia, increased acute infections, drugs. Who is making this sound? Acute infections, spontaneous bacterial drugs, serious sedentary person, viral surgical procedures, border systemic shunt, development of hepatocellular carcinoma, uremia, constipation. All of these things make sense. Look into this thing. Okay, grading. Read at. What was the matter page number of this thing? Because this is much shorter. Read at M. Because this grading is important, but this is not memorizable. Acute hepatic process under specific fact which mass of the brain and this sleep occurrences. Yeah, I understand it's acute and hepatic. It's common sense. Disperson's consciousness. We disturb reservation of the tail. Changing personality, mood, intellect, nausea, vomiting, weakness. Move on. Let's go. Let's go. What are the signs? What are the signs? The signs. You don't have a lot of time, do you? How much time do we have? 28 minutes. Wow. We have lost 20 minutes already. Single topic. Flexor hepatis, sweet smell, asterixis. 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 Interruption of why asterixis happened? Really, interruption of the posture pathway in rostral reticular formation and abnormal joint proprioception. That's nice. Interruption of the posture pathway in the rostral reticular formation and abnormal joint proprioception, absolutely possible. Called as negative myoclonus. Describe it. Okay. Fracture in neurological symptoms, hypertonia, hyperreflexia. Okay, diagnosis based on clinical features. Diagnosis is based on clinical feature. Rated number connecting test. Critical flicker frequency. Maximum frequency. This is very difficult, man. What is this critical flicker frequency? I don't know. This investigations. Investigations are blood ammonia levels based, obviously. Yeah, raised. What is PSC? What is PSC? full form of BSc. Oh, portosystemic encephalopathy. Come on, man. Ha. Hmm. Serum 3-nitrotyrosin elevated. EEG. I think it's better given marrow EEG. This is the thing now, you can refer to multiple sources to it. Like it's a triphasic pattern. They didn't even mention this thing. EEG changes, okay. EEG changes in M465 underscore 70. Zero albumin increased. Proteins normal. Yeah, this is true. You have to image to rule out other causes, otherwise, how will you figure out? Okay, now time for the treatment. Mhm. In general, in the 30 ml increase 30 to 50, 15 to 30 ml 3 times orally per day, increase till 2 to 3 loose stools per day, increase laxator. Similar action, more palatable. Beta galactoside. Similar action, more palatable, better than lactulose. Poorly absorbed antibodies is adjuncted of the gut rules, automatic emission of administration introducing real side effects. Neomycin metronidazole defects and sensitive bacteria. Hmm. 550 milligram twice daily. I think 400 milligram thrice daily is okay. It's memorizable. This is very important. Minimal, we start with active dose, good response, maintain medications and nutritional treatment. Bad without the prompt change mana instead of what dose, little without poor no response, it will fix it. Anyways, you get good response, maintain poor responsibility, liver transplantation. Okay, good. It took 30 minutes for you to leave, but again, simple, but instead of what the fuck. Hmm. I need to just take a look at. Oh my god, there's so many things. Oh wow. You need to get a case of ascites, man. Ascites is big, huge ascites. Okay, let me see a question of SBP, then I'll read it, otherwise not. Right now, its meaning is to complete the SBP factors in decay. Okay. It's quite a hard thing. Okay, what was that? What is clonus? What is myoclonus? Hey, you didn't write the answer though. Come on, what is wrong with you? The idea is that AC inhibitors cause constriction of vasoconstriction. Okay, so if there's already renal artery stenosis, more vasoconstriction will just lead to the kidney dying off. Where is the answer and properly? I know the answer, but how do I write it? 119. Yes, found it. This is the exact cause. Whoa, they had antihypertensive therapy. See the hypertension flag anyway. Yeah, because they can reduce the filtration pressure in the glomeruli and result in renal failure. Electrolyte screening should be checked. Yes, this is the exact reason. Yo, this is should have happened in GI system. Why did this go there? It's not enough. It's not enough. How many minutes do I have left? 24 minutes. Okay, nice. 20 minutes finish it. Paper in an hour. Wow. Maybe I'm just thinking too much. This is 4. I know I have a break. Okay, I'll just enjoy the break. let's get it. In a short time, we'll be finishing up this. I uploaded this one. Fuck. I forgot I uploaded this one. Sorry. Stupid man. It's not gonna take a lot of more time. Finish it and move on. Complicated virus malaria. This I have to read. This I did not read. Malaria. 407. Wow. It's a very long thing actually. Malaria. 407. First we read it and then we mark it. By the way, what is complicated malaria? Criteria for severe and complicated malaria. I think this is the answer basically. It's literally the criteria of getting into it. What's the definition of complicated malaria? Let's read it once. Okay, I haven't read malaria properly for the last few years. Oh, by the way, what does the question say? Question says complicated Vivax malaria. Only Vivax. Hmm. We're checking questions. I think it will be there. It says complicated Vivax malaria, not complicated falciparum malaria. So, what is the complications which Vivax does? Anemia, thrombocytopenia, mild jaundice, splenic rupture. Means complications similar to those of pre-falciparum. So, falciparum malaria যা যা হবে তাই তো হবে. Right. But let me just read it once, okay? There's no point in life cycle এখানে দেয়নি. it's ready to read in the next page first. Now it's time to study. So it's study first, then we'll look at the rest of it later. How much time do we have? 30. Wow, I've wasted 8 minutes, 12 minutes apparently. Humility is a very important question. You can't just miss out on this thing. Maybe the photos of only health most severe. Vivex most common. Uh, Malady 72 hours. Relapse. Yes, Google and Vivex are huge. That's pyramid. Hmm. Okay, human cycle, mosquito cycle. No, you have to read. Just virus infected. This human cycle. So the introduction of infectious parasite with the pre-erythrocytic. Uh, uh, People in one. Hmm. See, this topic was repeated, so yeah, look at the repeats topics, and slowly the topics are probably going to start to be repeated. So yeah, finish time now. We're gonna update this topic over here. Diamond Harbor completed. I'm gonna go in next. Wait. Uh, 6 is the target. I don't know how it's gonna be 6, but yeah, Diamond Harbor is completed. So I just put a green over here. There's a lot left to be done actually. ASI 8 ASI also said some pretty decently bad questions. Okay, I've got a promo timer. Uh, Since paper 1 and paper 2 they have done. Okay, so I'm not gonna go to paper 2. Yeah, all of these are I think paper 2. Infection of HIV are going to go on paper 2. Yeah. Let me just look at paper 1 and I'll read the topics paper 2 also. It's not like I want to solve them, but I'll read them out slowly. A 66-year-old diabetic presents the complaints of his business. This is all that AMI and stuff. Now you see the known history of smoking of 30 years. Yeah, again, AMI, very common history of smoking. I think smoking kills more people with AMI than actually with cancer. More people die of AMI than cancer. People don't understand that's definitely sure, but how would you manage this case anyway? Study. Okay. Yeah, these are all doable questions. I think. Close to man. Wow, upper GIP, lower GIP. Sorry. I think we would have it better in written in surgery, but okay. Patient has been diagnosed seriously, so that not very. These are the things I don't understand. Man. You're doing melanoma. Okay, it's a medicine topic, but it's actually a post-surgery topic. Nephrotic syndrome, approach nephrotic syndrome, differential nephritis. It's a very classical question. Atrial fibrillation, classical question. When you have abdominal fullness decrease apparent for 2 weeks. Okay. One episode of vomiting of blood. Okay, ascites, which complicated into esophageal varices. Okay, these are very classical questions actually. Good for me, it's favored in a patient with compromised urine function. Okay. Why? Because they're cleared by the kidneys, so they might just accumulate. First damage. Yeah, good questions. These are, I think this paper would be very enriching for me, but right now I'm not take a break. I'm just too tired. Just too tired. Let me just check on my WhatsApp messages. How much time? 7 minutes. That's okay. Not bad. Wow. It was nice, right? My father has bought for a new home. Not bad, man. It's pretty good. It's a night light which he has brought. Wow. This is my room's night lamp. And they apparently painted it without asking me in a green color or something, which I did not consent to, but it's okay. Their choice. Wow, this is lights of the staircase. Like, wow. It's getting a lot, man. But yeah. All colleges 9/7. When did this happen? Oh yeah, this is my link only. Oh yeah, yeah. This is my link only. 35 questions raised by the victim's family against CBI. The families appealed for a re-investigation, raising 35 questions for the Archibald incident. Why haven't four doctors at dinner of the night taken into custody and interrogated? Nikki has been. Oh man. How CBI handled this, it's like, I won't say it's bad, but I expected more out of them, man. And maybe I can say it's bad. You're the top investigation agency of the nation, and you can't figure out a case which happened inside a hospital. It's just bad, man. I'll just go to the washroom, have some take for myself, and maybe I just excuse myself. So, break time for me. Don't look at me. Privacy. Okay, yeah, I'm back with this green hoodie of mine. This I want to call myself as a green flag with this one, but apparently people call me a highlighter with this one. Whatever. The current college is not Diamond Heart. It's ESIC. What's the name of the college actually? ESI. Yeah, I got. Yeah, because the postgraduate medical division research part is actually the higher college, not this one. Okay, so let's look at the questions. Okay, 66-year-old diabetic male present to the ER with complaints of testosterone squeezing, type of pain with profuse sweating, clear case of MI. What's the professional? Okay, I forgot to update that. This is the third Pomodoro actually, not the second one. Yeah. Enumerate the strategies prevention of both. How do you confirm diagnosis? Let's just look at the what we what if we should remove the book from over here because otherwise it's gonna cause some problems. Oh, 66-year-old diabetic male. Yeah, it doesn't really change it. Diabetic people have arteriopathies, and because of that, they might have this problem. Yeah, extremely possible. Let's look at what they have to answer over here. I think they should go into cardiology. Yeah, what is it? What is this? What strategy would we employ for secondary prevention? Okay, primary prevention is not letting the disease happen the first. Secondary prevention is, I think, prevent the complications, right? What are the types? Treatment. Primary, secondary, tertiary. Primary aims to prevent the disease or injury before it's occurred. They aim to reduce the impact of the disease, like basically prevent the complications, soften the complication. Hmm. So secondary prevention, the impact of the disease, that is secondary prevention. Yeah, that's what I was saying. So the management of MI is not coming to that. No. Entire thing of MI is going to come into that secondary prevention. Let's just look at it. What is the problem? It's AMI. What do you think? Acute myocardial infarction. Yeah. Along with vomiting. Wait, now this is getting interesting. It's saying profuse sweating, not aggravated on vomiting, not aggravated on walking. Does might have this kind of presentation? It does probably. Oh, but if it's associated with vomiting, it can be a malarious tear also. Osteochondritis pulmonary fractures. Diabetes also is a procoagulative state, so can be some embolism of time. I think this. You're saying me, how will I manage this case? And then you're asking me, what do you do for secondary prevention? What? Like put him on long-term beta blockers. Yeah, ACEI beta blockers. I saw. I don't get it. This is a clear case of MI. Why am I thinking this much? Sorry, I'm confused this diagnosis. I think acute coronary syndrome would be a better fit. No, acute myocardial ischemia. What does it mean? It means that your heart is not going to like it has acute myocardial infarction. It has a permanent problem. That's an infarction. Hmm. This is a this is I would call it a AMI. So putting it on a cross. How do you confirm your diagnosis? You do ECG and you do drop T and then you do echo to look for wall motion abnormalities. I don't think there are anything else. Am I missing out on something? No, someone needs to do something. Ischemic heart disease should be there. 28. Then I really do not know. What but you can't just write ischemic heart disease, right? I think that would be very well accepted. Hmm. Sol anti-anginal drug treatment. Is it an angina or is it MI? I don't get it. Is it unstable angina? No. Brought on by physical exertion. It's not increasing on physical exertion. Not aggravated on walking. It might be aggravated on running. You have not you didn't written that thing now. Squeezing pain, feverish ischemia. Has to be MI. I think these are the tests which we're talking about. Investigation ECG. Because it's right now it's angina. It's not even more than it's what do you call it? It's angina pectoris. That's what AMI or angina pectoris. Where do I stop? Clear zero blue. Talking about investigations, there is a lot of investigations that are possible. Resting ECG, exercise ECG, exercise tolerance test. Yeah. What are the contraindications? Acute myocardial infarction within 2 days. But how you know what's a drop T করতে হবে তো. Where is the drop T? I don't find drop T. And stop smoking. You also need diabetic control, for fuck's sake. Full on cardiac pain, warning, complications, arrhythmias, tissue damage, investigations, ECG. Yeah, unstable, stable angina. Yeah. What do I call it? It's why shouting like okay, you are shouting like an obviously you're shouting like that. I don't get it actually. What do I write this case as? Angina pectoris, unstable angina, EMI. Like, what is the? It's not very clear to me. I don't understand it while reading the book. Why isn't it over here? It was a question about cardiac markers, but not very well written. You won't get. Okay, now you have 6 marks management, immediate management. Hmm. 6 marks you're giving for the management. How much is enough? Mhm. CKMB is rises the highest. So it's, oh man, I thought this question is gonna take a lot of less time than this. Probably DCG. Let's do this one. I think it is sufficient for 6 marks. This I think is sufficient. Let me see what they have written over here. On a specific topic. When are they going to get the think in that respect? Okay, so they've written thrombolysis in a separate page altogether. And CABG also separately. But that is tertiary, na? Primary is preventing the disease from happening. Primordial is including market. Sorry, Pepper, I just don't want to copy strike right now. Just learning, anyways, you have kept it public for you. I guess people can see that I'm taking it from red direction. People can see it. So please. So secondary is early diagnosis and prompt prevention. That is what they're asking, right? What strategies you would apply for secondary diagnosis? Early diagnosis and prompt treatment. Basically, if you're preventing the complication, you're diagnosing it early and you. I don't get it. What are you trying to say, man? Primary prevention is preventing the disease from happening. Primordial is equal on the disease, we are preventing the risk factor from happening. Tertiary is that the complication has happened, we are preventing it from further progressing. I don't know what quaternary is. Oh, quaternary is to prevent overdiagnosis. What do you mean? How do you prevent secondary? This is going into unstable angina then, na? How do we I don't get it. Just first read this up, okay? Then we'll see the rest. First read it. First we'll study, then we'll do the rest. Investigations, okay? ECG, cardiac biomarkers, other chest X-ray, echo. Hey, radionuclear scanning is too much. Quest 11 to 12 is much shorter. How was it? The time's already covered. I got some sound over there. So it looks like anything. So I think I'll prefer this one. This is much better. Contradictions to figure out here. Okay, if you do not have contradiction, maximum related from primary PCI to the present to build inflation 60 days. Patient joins with 1 hour according to me. It may be recommended that there is clinical and or ECG clinical and or ECG evidence of ongoing ischemia between 12 and 24 hours after symptom onset. Maximum acceptable delay for primary PCI from presentation to balloon inflation is 60 minutes. Door to balloon time is 60 minutes. If patient presents within 1 hour symptoms or if patient presents within 1 hour or 90 minutes of patient presents later. My glasses have a lot of dandruff in them. I need to clean them out. It's becoming hazy and it's getting difficult to concentrate. Report questions for STEM. So just prefer in the following situation: early presentations, less than 3 hours no onset of symptoms. In patients where primary PCI cannot be done because the following categories laboratory occupied solution available as per difficult lack of access. PCI delayed to primary door time is door to balloon time. Door to balloon time and door to needle time is greater than 1 hour. Door to needle. When a needle to balloon time should be less than 1 hour, basically. Door to balloon time is greater than 90 minutes. Okay, door to balloon time is greater than 90 minutes. Or needle to balloon time should be 60 minutes. This is the thing. Primary PCI solely, which PCI is solely used solely in acute MI. It is indicated in cardiogenic shock and is patient to whom thrombolytic therapy is contraindicated. It is generally preferred with the following: skilled PCI, good surgical backup, door to balloon time is door to needle, basically needle to balloon time, high risk myocardial infarction, CHF greater than 3, contraindication keep analysis, SQPTI. But what is it? They just go in and put in a graft primary cutaneous intervention. PCI stenting is it's basically stenting, right? CABG recommended failed PCI with persistent pain, patient resisting CABG. I get it. Okay, so the answer would be this is that. Specific management information. This is what I wrote. Let's go on to the next question. Okay. Define CKD. Describe the stages of CKD with reference to blah 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 blah. Blah. This is a standard question. Describe stages I've done on. What is CKD staging? Causes. CKD they want or there's nothing careful to us. Maybe they've asked all this. The CKD very properly. Fifth question is going to happen. And right common cause of CKD. Oh, come on. Has to be difficult. It's impossible that I did not write the common cause of CKD. How is it possible that I did not write the common cause of CKD? Check. Hey, we discussed about anime also, no? Oh, anime also discussed. Okay, enumerate the complications of CKD. It's very easy. Complication of CKD. I think this would have it. This is a very common question. Right. Anime and CKD. Wow, that's 111. Good question. Only this much. I think I would need more. They don't have competitions of CKD. Wow. Not the competitions of CKD. Interesting. The book will have it. 10.19. Oh, even anime and CKD. Hmm.